Hi, my name's Chris Sear, Chief Medical Officer for Telecare and nephrologist. Today I wanted to give you my view on appropriate billing for physicians via telehealth. Firstly, there are 4 major item numbers physicians usually use. As of July 1st, 2022, these telehealth item numbers are only available for video calls, not telephone calls. I've listed the item numbers below. As you can see, there are 2 complex item numbers, one for initial and one for review consultations. There are 2 standard consultation item numbers, one for initial and one for reviews. The 112, which was the extra item number for rural telehealth, has been removed. The complex initial item number is a 132 for face-to-face or 92422 for video calls. It's the highest paying item number at about $240. It requires the consultation to last 45 minutes and you must address at least 2 comorbidities. It needs to include a comprehensive assessment and management plan, and I encourage you to visit the MBS website for more details. Notably, you may only bill this once every 12 months, but you can bill it if another physician has billed it within the last 12 months. The item number 133 or 92423 for video is the follow-up item number for a 132 or 92422. Again, 2 comorbidities need to be addressed, but the duration is only 20 minutes. You personally must have billed a 132 or video equivalent within the 12 months of the date of the 133 for this to be valid. You can claim this twice within a 12-month period following the 132 appointment. Please note that the 133 or 92423 item numbers must be billed within 12 months of the original 132 or 92422. For example, if the initial 132 was on the 1st of January 2021 and the second consultation was a 133 on July 2021 and the third consultation occurred on the 2nd of January 2022, the third consultation must be billed as a 116, not a 133, as the third consultation was more than 12 months after the initial 132, even though the third consultation was only 6 months after the second. A 116 must be billed. Standard item numbers are more straightforward. The standard initial item numbers are a 110 or 91824 for video. The consultation must last 5 minutes and there's no telephone equivalent. The standard review item number is a 116 or a 91825 for video, and it needs to last 5 minutes and there's no phone equivalent. For time-based consultations, it's important to recognize that only patient-facing time, not administrative time, counts. MBS states that a visual and audio link must be maintained for telehealth appointments, and clerical work performed after the consultation does not count towards appointment time. MBS also recommends documenting the date, time, and duration of consultation, and I highly recommend doing this if you're billing 132s or 133s or the video equivalent. It is common practice among some physicians to request a new referral annually and start a new initial billing cycle. In my opinion, this is not correct. Medicare refers to a single course of treatment as covering an initial attendance followed by subsequent attendances until the patient is referred back, i.e. discharged back to the GP. MBS explicitly says that a new referral does not always constitute a new course of treatment. However, a new initial item number can be billed if all of the following apply. 1. The previous referral has expired. 2. The patient was last seen by the specialist at least 9 months ago. And 3, the referring practitioner decides the patient's condition needs to be reviewed. In my experience, this is quite a rare occurrence. So if a GP sends a new referral for an old patient, can you bill an initial consultation? Well, if it's for an unrelated or a new condition, then yes, you can. If the GP only sent it because the previous referral expired, then no, you can't. If the GP determined that the patient needed to be reviewed, the previous referral expired, and it has been more than 9 months since the last review, then yes. If you've discharged the patient, the GP re-refers the patient to you, but the previous referral has not expired or it has been less than 9 months. It appears to be a bit of a grey area. On the one hand, by discharging the patient, you are ending that single episode of care, and hence the new referral should start a new episode of care. But on the other hand, it does not meet the MBS criteria to bill a new item number. My practice is to err on the side of caution and bill a review item number. This scenario, where you have explicitly discharged the patient and the patient is quickly re-referred to you, should hopefully be uncommon. What about telephone consultations? Unfortunately, for telephone consultations, only the 91836 is available with low rebates of $39. So in summary, be safe and conservative with your billing. It's not worth a Medicare audit, and at the end of the day, you are ultimately responsible for your own billings. I'd recommend documenting consultation times when billing complex item numbers and only count patient-facing time. In the vast majority of cases, bill review item numbers for old patients, even if a new referral is received. I hope this information has been helpful. See you next time.